The first thing we're going to start with is going to be going over what are things that you guys want to hear about, kind of like we did last time, so you can start to think about some questions that you might have and bring those to mind. And cheers.
She ran to the restroom.
Do you guys, we could write down their questions. Do you want to do their questions?
Sure.
Do you have anything on the top of your brain that you really want to know about? Make sure we cover.
No pressure.
I'll do our intro for the video, and then we'll go into questions, and then I'm going to write all the questions up there. Welcome to Aligned Motherhood. We are so excited today to be talking about pelvic floor health with Jobeth McKoon. And we're going to start with questions. So what do you guys want to hear about? And I'll write some questions up on the board. So I will go ahead and start us off with some of my questions. Maybe Ashley can throw in a few questions, and then we'll cover all the room. So I'll head over here. So first thing would be, what's common versus what is normal? We hear all the time people say, oh, well, I can't jump on the trampoline anymore, or I can't run anymore because I will leak, or I have pain, or I can't sneeze, I have to keep a chain pad all the time. Is that normal or is that common? So what's common versus normal? Ashley, do you have anything on top of your mind?
Let's see. Do mamas that have C-sections still need to work on their pelvic floor?
All right. Amy, anything that you could think of that you want to make sure we cover today?
The tearing versus, like, I had a episiotomy with my first because she's 10, so, and then for with this one, does that make a difference? I feel like it did, but I only have 2 kids, so, really, so.
Morgan, Mackenzie, any questions, anything you want to make sure we cover today? Tension, weakness, anything else?
Emergency to go pee. I have to go 2 minutes ago.
Awesome. We'll make sure we cover all these topics, and then, yeah, we'll go ahead and get started. So first thing is just kind of an introduction to you, Jobeth. So how did you get into pelvic floor health, and what's been your journey?
So I've wanted to work with women pretty much my whole life. I got out of high school, thought I was going to be an OB nurse, was going to go to school, and it was yucky, and I didn't do that. So I ended up having my own babies and going a different path, and then going back to school later to be an occupational therapist, and didn't really know that occupational therapy could do pelvic floor, but it makes sense. We work with the bowel and the bladder and intimacy and you name it, right? Rules, habits, routines. How do you do all of those things if you're incontinent? How do you do all of those things if you're having pain all the time, chronic back pain, those kinds of things? So I did inpatient rehab for 4.5 years-ish and skilled nursing, and got to a point where I was like, there was a really cool class I was seeing that I was like, ooh, I think I could do that. And I ended up having shoulder surgery on my own body, and I was going to be out for a while, and it was perfect timing.
Yeah.
So I got to dive right into that and found some really great people in the community to help me. My first boss in pelvic floor was Julia at Core, and she was fabulous. She helped me learn a ton. She mentored me and knew from the very beginning that this was the dream. So I worked for her for just over 2 years. I started my business while I was still there with her blessing, and it grew so fast that I left far sooner than I thought I was going to, and we've been off and running since.
Awesome. And that was about 2 years ago-ish?
It was 2 years ago in September.
Okay. Yeah. Very cool. And what about when you were doing it before, when you were doing skilled nursing, what about pelvic floor? Why were you interested in that class? What made you?
I think it was more personal than anything.
Mm-hmm.
So I, even as a child, could never jump on a trampoline, ever, without leaking. So I would put a pad on in 2nd or 3rd grade, or put toilet paper in my underwear because I would leak. And then fast forward, I had 2 babies very close together. My kids are 18 and a half months apart. So it was, you are definitely leaking when you sneeze. Like, definitely, right? And constipation and hemorrhoids and all of the things. And then fast forward several more years, ended up having to have a hysterectomy at 36 because I had adenomyosis, endometriosis. I run the gambit of all of the women's things. I have no spare parts left. And then sought my own therapy after that as well. So I've seen both sides of that. So it was really like that personal journey and wanting to be able to pour into other people what was poured into me.
That's kind of rare and unique for a child to be experiencing that week. And what did
It's less
What
rare than you
did,
think.
oh, really? What did, I would assume you talked to your parents or your doctor, and what did they say? Oh, you'll grow out of it? Was it that kind of thing? Or what did
I
they...
never, my mom knew, but it was never a thing. It was, oh, okay, that just happens. It wasn't something that was common knowledge. There was never education about that. And it was the 80s and early 90s, so it wasn't something that anybody talked about. I was just more embarrassed than anything.
Right, you didn't want anyone to know.
No.
Yeah.
And that's the same thing with moms and with women. You don't have to have a baby to have any of these issues. I have moms women who've never had a baby, and they're 50 and they're like, oh, I never had a baby. That's not me. So this just must be, I'm aging. No. So many things seem like they're normal because we're getting older, but they're not.
That's such a common excuse we hear all the time. Oh, I'm just getting old. Headaches are not part of getting old. Like, that's not a thing.
And having to go to the bathroom in the middle of the night, that's not supposed to happen until after we're 65. During pregnancy, a couple of times maybe at night, nothing excessive. You shouldn't be getting up more than 2 times at night. That's crazy, even while pregnant. Now, the last few weeks when there's a baby's head right on your bladder, I get it, right? We'll work on that later. That will be relieved, but there's definitely things that.
And so for some people, you might have heard the term pelvic floor, but maybe you don't really know what that is. What exactly is the pelvic floor?
I actually brought props. So this little handy dandy little guy is a pelvis with all of the pelvic floor muscles in it. So you can see what that looks like. So we've got the pubic bone here, and the tailbone is right here. So if I am doing an exam on someone, it actually shows exactly what muscles I'm touching based on how deep my finger is. So the pelvic floor muscles are like a sling in the bottom of your pelvis. So they are for intimacy, they're for going to the bathroom, and they're for organ support. So essentially, men have the exact same thing, but they don't have a hole in the middle, right? So they're like, I can't have pelvic floor problems. Oh yes, you can. You just don't come to me. You go to somebody else. But for us, because our organs are held up by basically a trampoline with a hole in the middle, we have to be a little bit more concerned about pressure management in our canister between our diaphragm and our pelvic floor, because we can put undue pressure down on that hole. And when undue pressure happens, we can cause things like pelvic organ prolapse, things like that. And there's so many things we can do to prevent that. So did I cover what you asked me?
Yeah, that's a big part of it. So number 1, number 2, intimacy, holding things up. Prolapse is a common one. Most people come to me and they're saying, oh, I'm so weak and I'm leaking. And most of the time, yes, the muscles may be weak, but what's really happening is that the range of motion is not there for those muscles. I would say probably 90% or more of women are carrying too much tension in their pelvic floor. So the muscle is holding here, and then you ask it to hold back with a sneeze, right? And you don't have that, nope, I'm not gonna pee right now. It's, okay, well, I guess we leaked a little, right? Or we leaked a lot. So what we really work on is being able to have that full range of motion of that pelvic floor. And pelvic floor therapy is whole body therapy, right? Your pelvic floor is the basis for all movement, is the basis for shock absorption in your body. So and this is tight,
that's where she comes in, right? Yep. And it goes all the way through. So I always like working with chiropractors because we were talking about this yesterday. Being able to go get adjusted, then come see me, let's make it stick. Because your fascia has to move, like your nervous system has to be involved. So you're like that huge piece to pull first or second. Either one of us can come first, it doesn't really matter. But it really is a nervous system job.
That's so important. That was an interesting thing we were talking about yesterday is with chiropractic and pelvic floor health, we think a lot of the structure, which really makes sense because if your hips are out of alignment, then of course everything on the inside is going to be twisted. You're going to have more tension on one side, more pulling on the other. But even more important is the nervous system. Because if your body is stuck in fight or flight, you're just holding all this tension in your entire body because you're running from a saber-toothed tiger, you're not able to do all those normal things.
Yep. And with the ladies in the room, it sounds like everybody had pretty good birth experiences, but, or maybe not, very long ones also. But your body's gonna remember those things. So in subsequent deliveries, what I can help with is to tap into your body and say, oh, hey, yes, that happened before, but that doesn't have to be the same story we play this time. And heal that story within your muscles and your nervous system so that your body will react in a more appropriate way for the current situation.
Jobeth, do you see a connection between emotional trauma and tension in the pelvic floor?
Yeah, absolutely. I see it often with trauma victims, or even when we say trauma, people think capital T trauma. Something really big happened, right? It doesn't have to be big. Your body doesn't know the difference. So it could be a partner that wanted it more than you did, and you were like, fine, right? It could be, and your body was like, I really don't really want to do that, I don't like it. And then farther down the line, your body's like, oh no, remember that time? We didn't really want to do it, but we did it anyway. We're going to do it not at all. So you won't be able to open for penetration. Those things can happen, all from smaller traumas even, but your body doesn't know it's small. And it feels big to the person that happened to. And that's all that matters.
Emotional trauma can even be not even necessarily intimacy related, but you fell off a horse
100%.
and it just scared the crap out of you.
Car accidents,
Car
often.
accidents, all those kind of things. So it doesn't even have to be I've never had intimacy related trauma, but you probably hit your hip when you were playing volleyball, or someone checked you in basketball. It could be all kinds of things.
And
then we have an
especially
emotional
repeated
connection
in sports.
over and over.
Horseback riding.
And with horseback riding, it's a lot of holding and clenching. And even like yesterday, we were talking on the phone and I was driving, you were talking about chronic glute and leg tension, and I was like, I'm literally glute clenching right now as I'm driving. I'm like, I need to relax. We don't realize how much we do that. Glute clenching is a big one in the pelvic floor.
If you notice when you're standing at the kitchen sink or you're cooking dinner and you're like, oh, my low back, oh, my butt, what's wrong with me? Unclench your butt. You will feel better. It's super common. One easy thing to do if you're standing at the kitchen sink for a long time, washing bottles or doing whatever, pop the cupboard door open, move stuff out of the way, and put one foot up and in the cupboard. So you're off weighted. It's a lot less likely that you will clench your bottom, and it takes some of that pressure off so it doesn't hurt or get us fatigued.
Both things.
Yeah.
Get a balance. So we were talking about pelvic floor trauma. Some people will say, well, I had a C-section, so I didn't have pelvic floor trauma.
Yeah.
What would you say to that?
So every single abdominal surgery that anyone ever has, even if it's an appendectomy, should have pelvic floor therapy afterwards. So your diaphragm and your pelvic floor work together. If there is any scar tissue, there's organs removed, right? Things get rearranged. The fascia around those changes, and the relationship between the diaphragm and the pelvic floor can change. So it's any disruption. So with cesarean, that's a big disruption, right? And people will come in and they're like, oh, well, I don't leak. I have like the weird numbness. Okay, normal. Well, I had a C-section. So, like, some may not go away, but it's not normal. And your tissue should still be able to move. You should still be able to do everything you want in a day and participate in your life exactly how you want to. You shouldn't have to like go to stand up and go because it catches you because it's tight. Those things should not happen. And they're easy to fix. You just have to find a provider to do it.
And there can be emotional trauma related to that too, depending on the reason for the C-section. Maybe
Totally.
you planned a C-section and you wanted to have it, maybe you didn't plan it. And it was like, for me, it was definitely the hardest decision of my life to decide to have a C-section, because that's the opposite of what I wanted. I planned a home birth, and then here I am at the hospital, and now it's like, oh, we have to do epidural. I didn't want that. Oh, I didn't want Pitocin. I didn't want all these things. And so it was emotionally really hard. And when I did pelvic floor therapy, we could do cupping on my C-section scar, and I would instantly faint. So I haven't done it yet. I know I should, but like, that to me.
Yeah, so you would start way
I was
way
like, you tried to
different
start here. Yep.
direction than that. Yeah.
So it wasn't even conscious, but my body was like, that's
Yeah,
not it.
for sure.
So it can be stuff that you don't even realize. Yeah, you don't. Oh, the floor is fine. Is it? What
Yeah.
is it?
I had a gal who had like a C 30 years before I saw her and was still having issues. And it was that emotional piece, and even just like working through and talking through it. And sometimes you just get, I don't know about you guys, I just get like an intuitive ask this, like just ask. And sometimes it's a miss, right? And people will be like, no, that's not it, right? Or maybe it's, okay, hey, have you ever had loss? And that sticks, right? So we were talking about preconception and like IVF and like that, right? If you've had those things and you've had a loss in that time, which is unfortunately more common than we would ever hope for anyone, those traumas stick often. And so those are things that we can work through too. And then bringing more blood flow to the area and getting those tissues oxygenated and ready for the next try.
So your body's ready, kind of an emotional
Yeah.
limbic system component, but also physically ready too.
Yeah.
I can speak personally to Jobeth's, when I'm doing pelvic floor therapy with Jobeth after the birth of my son. She healed my pubic symphysis pain because my son was like a 99th percentile head with both of his hands like this, like right down my pelvis. By the end of my pregnancy, I was basically bedridden. I couldn't walk. And then the pain persisted after I had my son via a scheduled cesarean. And Jobeth was doing an examination and like feeling my pelvic floor, and I can't remember like exactly how you asked it, but she's like, "Do you have a history of trauma?" or something to that effect, and I'm like, yeah.
More gentle.
I don't want to take up the time talking about myself, so I'm giving the abridged version. But Eva was asking me about my history because she could feel the specific tension in specific parts of my pelvic floor. And then like talking through releasing those and talking through why the muscles hold those feelings and that trauma, it was really interesting to witness that in real time and like feel these in what tightened pelvic floor muscles feel like when they're being, and then feel the difference and like the pliability afterward and the afterward. So that was very interesting, and a lot of the pelvic floor with therapy with Jobeth is kind of talking, saying, hey, do you feel this difference? And if sometimes I would be like, no, I can't feel a difference. And she's like, okay, well, how about one? I'm like, oh, okay. Or like, didn't know how to understand what I was feeling. Like I was something, but I guess I couldn't like describe it. She would like talk me through that. So yeah, really, when I'm sure for you and for the patient.
Yeah. It's, you said, like how I did to you, what it's like to me to feel, it's not that I'm feeling the trauma in your body.
Yeah.
I'm not, right? But your body has certain reactions. And I'm feeling that. And so I can then tap into that and then start asking those questions. So my undergrad degree is also in psychology, so that helps. So I kind of understand it as well. And as an occupational therapist, we do a ton of mental health as well. So I can bring those things in and help you kind of incorporate. I really feel like doing manual pelvic floor releases are so helpful with skilled hands. So there are some people who love to do like a biofeed and things like that, and that gives good information for a lot of people. Not everybody learns that way. Not everybody is receptive that way. And for me, I would never be able to tell the difference with what your body is doing in that real time moment if it wasn't through touch. Does that make sense?
You know
So-
you've made a change.
Yeah. But also feel like, okay, if I go to this, let's say it's the right side, okay, and I body go, right? Okay, did this close on that side? Probably.
That was it. That you triggered my memory.
Yeah.
Yes, that was it.
So it's often tighter on the side that they close. And then so you start a conversation. And then that can kind of resolve itself sometimes. And it's not a ton of hard pressure. It's not super painful. It shouldn't be super painful. I don't want to send your nervous system through the roof because I'm hurting you. I don't want to do that, right? So people will be like, well, it doesn't really feel like you're doing anything. Like stand up and eat. Oh yeah. Feels different.
What are some of the signs or symptoms someone might feel if they have pelvic floor tension?
Low back pain, pain within, or not having a lot of feeling during intercourse. After a C-section, you might have like lower belly pain. Really take a very deep breath. Let me think, what else? Go to try to go sit to stand and it kind of catches you out of nowhere. Those are all really big signs of tension. But most of the time, we don't walk around aware of what our pelvic floor is doing, right? If we are, there's a big problem, right? Right? We're like, we either just had a baby and we had like an episiotomy or, you know, those types. Of course, you're going to be more aware at that point. You have a wound, right? Thankfully, episiotomies are less these days than they were. Yeah. But like thinking of those lines, you know, it's more on its tension.
And speaking of episiotomies, what are your thoughts on episiotomies versus natural tearing?
Sometimes they're necessary. I mean, but I would never risk a mom or a baby, and I get that. So I can't really speak to that. Natural tears are easy to heal, because it's not a project. It's not. Scar tissue is different, but yeah, I trust you have to trust the provider that you choose. And if they give you the ick, change providers. You can do it the week before you have your baby.
Yeah, sure.
It could be anyone. It could be a pelvic floor therapist and you're like, no, I don't like you, find somebody else.
Right.
But do it for yourself.
Myths and truths pelvic floor. Just do more Kegels.
I can count in 5 years on one hand how many times I've told somebody to do Kegels on purpose for the just for strengthening alone. And I think it was probably 3 people and they were all over the age of 80.
Okay.
Coordination, yes. Okay, 90% of us are walking around and we're already like this and I say, okay, squeeze more. Squeeze, getting strength, you're getting more tension. So until we can get the body to go, it's usually, once that range of motion is there, the coordination comes back. And you do every day, that's strengthen it.
Yeah.
It should be. I think clamshells suck for the most part, right? Sometimes there's a time and a place, right? But for the most part, isolated Kegels and clamshells are not very useful. Functional, playing with your baby, getting up off the floor, going swimming, doing the things that you would be doing and want to do are much more effective.
Yeah, for strengthening. Yeah.
And for your range of motion.
So it's too late. I'm too old. You said you've had some
Yeah.
clients who were in their 80s.
The oldest client I ever had was 98, and she did fabulous, you know? Yeah, listen, you could have had a C-section, like I said, 30 years ago and come in because you're leaking and you're having pain still and all of these other things, and we can fix it. Yeah,
Yeah.
yeah.
And that's another myth is like leaking. Oh, I'm back in diapers because you're over 60.
Yeah, and that's not all. And even after babies are born, women are like, oh yeah, no, I just leak little now, I've had 4 kids. Yeah, no. And somebody asked urgency. So oftentimes urgency it can be a habit, like maybe we have been out with our family and like we pull into the room, we're like, I'm home, I gotta pee, right? It can be that we're chronically dehydrated and our bladder is irritated because your kidneys are never gonna not filter. So all that stuff that comes out of your blood that your body doesn't want goes into your bladder. Kind of sandy, right? So you're walking around, you're doing all the things, you're taking care of all your kids, and it's grinding that into your bladder wall and irritating the lining. So if you go, no water, no water, no water, or even a little bit of water, it could be either one. Your body's like, water, let's get it out. So it's gonna give you that urgency, make you run to the bathroom, and you're either gonna go like a teeny tiny bit, you didn't really have any water, or you're gonna flush everything all at once.
I chug water.
Yeah. So
I try to get left in with breastfeeding, and it's like noon and I've had sips from my water, so then I'll chug a bunch.
And then you're gonna have massive urgency.
Yeah.
Yep.
And then I'll be like, stop,
And-
I gotta stay here for a second.
Right? Yeah. And I had times I had urgency so bad when I was nursing my babies
Yes,
that I would be like, nope, you're coming with.
I do that.
You have to. And that's not normal.
It's not.
Don't be like I was. Yep. My kids were up in the middle of the night and I couldn't not go to the bathroom first before I nursed them.
Yeah, that's me. And it was just because they're sitting like on my bladder, kind of like when I.
Yeah. And it can be abdominal tension too, right? I mean, there's 1,000, but the easiest one usually is moms don't drink enough water.
And sips throughout the day, kind of constantly drinking the water, not just chugging one glass.
Right. Yeah. So the easiest way to think about it is like a 3x3 or 3x5. Okay. So 3 vessels, usually ounces. Okay. By either 3 or 4 during the day. Some people can't get it in by 3. They're like, forget that. I'd be like all the time, right? Convince themselves that they just have to pee all the time. Another reason why people have urgency. But if you can do, like, say you get up at 6:30 in the morning with your kids, by 10, you should have your first one just about down, right? You should be drinking water before your coffee, 16 ounces before you have your first cup of coffee. That takes out half the water bottle, right? The less times you have to fill your water bottle, the better, which is why I suggest 32 ounces. Lots of people have Stanleys and those are 40, right? Then you have to feed even less during the day. But minimum always is half your body weight in ounces of water a day. Minimum. You add on any breastfeeding, you add on any feed outside, you add on life, you're gonna need a little bit more than that.
Coffee counts as negative water.
Depends. Caffeinated is negative. If you can do herbal tea and it doesn't make you have to go pee like a diuretic, you can count it. If you start drinking it and you just start peeing constantly, then we're not going to count it because it's just irritating your bladder. So you're not able to use that water. You're just flushing it. But there's lots of herbal teas that people drink and they're like, oh, I can have like peppermint tea or whatever. I get sick of drinking water. Or like me, I do like a cinnamon tea. Because I get cold. I'm like, I don't want to drink water, I want to drink hot tea. So I'll fill my 2-ounce Yeti with hot water and do a tea, and then that'll count.
Or like water, lemon.
Yeah.
Lemon can be irritant for a lot of
For
people.
some people, for sure.
So, so you gotta pay attention.
Yeah.
If you do it and you're like, ooh, I really have to go pee a lot, maybe we switch it up.
I had a good friend in school who she had to pee like every 45 minutes. Like we'd go on a drive and she would have to like get out of the car and run into a room of business to go pee or an alley or whatever because she would have to pee so bad. And we found out it was citric acid. She was sensitive to citric acids and she loved anything spicy. So it's hot sauce, every hot sauce, acid in it. And so she had to give up that she was just gonna have to pee every 45 minutes.
Yeah, and tell people that too, you know, as you're learning me, there's gonna be certain things that you're like, yep, I'm willing to do that, and certain things you're like, I am not willing to do that because whatever is happening is worth it, you know, and that's fine. Body, like for me, I will not give up coffee. I love coffee, and yes, I have to pee 2 extra times in the morning. I know I do. It's just because it is totally worth it for me. Because I like the ritual of it. I like the, you know, the slow.
Yeah.
I'm fine with peeing 4 times. Some people don't have. So
drinking water would be a big thing some people can do like today to help water. What are some other things? I like when you're doing dishes, put 1 foot up. What are some other things that people can do today that would help either help your pelvic floor or at least not make it worse?
yeah, the first thing everyone is diaphragmatic breathing and habit stacking it. So don't worry about doing 5 or 10 minutes a day and adding more to your plate.
Get up earlier.
I mean, you could do that. No one's gonna do that, especially when they've been up 5 times as a kid. Like,
If the answer is get up earlier, it's not.
exactly. But if I told you,
Find a new
hey,
doctor.
every time you go to the bathroom, take 3 to 5 diaphragmatic breaths, you can do that. And when moms are like, oh, but I always hurry in the bathroom. Like, are you pushing your urine? No, please don't. Slow down, feet flat on the ground, unclench your butt, and do your breathing. When you're doing your breathing, you're relaxing your pelvic floor. You're working that coordination. You're allowing your pelvic floor to do its job. And one of its big jobs is elimination, right? If we are sitting on the toilet, you're gonna be able to have better bowel movements. You're gonna be able to have fuller pees. So like you'll sit down and you will actually fully empty your bladder. If you're sitting and you're like, nope, still feel like I gotta go, drop down onto your knees, do another big breath, breathe into your rib cage, let everything soften. You're gonna fully empty your bladder.
Don't push.
Don't push.
Well, and another one that I recall us talking about is something that I wasn't aware of is like if you're ever struggling like constipation or things like that, it's not holding your breath when you're pushing. And it's funny because now that I'm a doula, I'm like, okay, that makes with like relaxing of the pelvic and like open glottis versus closed pushing. You know, you would, if you're straining the bowel movement, that you're gonna like bear down and hold your breath and push. And Jobeth was like, no,
Please don't do that.
We have very long about how you should be breathing through having, whether you're constipated or not, through having a bowel movement and not like holding your breath when you're moving. And for me, that was like amazing. Like, oh, I hadn't thought of this before.
Yeah. And
I don't even know anything.
Yeah.
I don't
right.
even know.
And a lot of people are like, no, I have a kid in the other room.
Yep.
Right? So that's an automatic use. But I would put money on that everybody in this room that's had a baby is never gonna leave their child in an unsafe situation. You would rather pee your pants than leave your baby somewhere that is unsafe. So you're gonna leave them doing something, they're probably in the bathroom with you, let's be real.
Yes.
But give
That's
yourself
how
the
it is.
time. It's an extra maybe 20 seconds.
Yeah.
Your kids are gonna be safe. If they're not, you're gonna run anyway, right? But 99.9% of the time, they're totally fine. And you deserve the time to at least be able to go to the bathroom.
Yes. Everyone deserves to take a good poop. There's nothing better than a good poop.
That's true.
Amen.
That's
I
true.
don't want hemorrhoids.
No.
Because that's awful.
Yep. It's
Yep.
not a fun time.
One piece of advice that I got from my pelvic floor therapist, which you can say if you think that's a good idea or not, was to actually do Kegels after a bowel movement to help with hemorrhoids.
I can
Just like
see-
1 or 2.
I can see why she said that, because it pulls things back into the sphincter. It would depend, so you can do several kinds of Kegels, right? So we can do one that's like only in the front, towards the clitoris, we have one towards the back, that's more the anus, we can do them together. That's all coordination. Some people don't have that coordination. So that's another piece of that too.
So you want to make sure you have good coordination to be pulling in the right spot, so you're not creating more.
Yeah.
So speaking of Kegels, didn't put this on our question list, but it just popped into my head. What are your thoughts on I see them targeted a lot for people trying to conceive. The little monk insert that help you, they'll watch cervical, but they're like, oh, you can do pelvic floor exercises, As a what are your thoughts on technologies?
I've had one not because I told her to get it, but because she wanted to. She was a very visual learner. So again, that biofeedback. So because she had already seen me, we knew that her coordination was not great. Her strength was not great. Then that was an appropriate tool for her, and she thought it was fun. Because you can watch on a screen and you get to play games and
Yeah,
it's
like a video game.
Yeah, your little, my chickens. Okay.
You can fly.
Yeah,
They can
exactly.
fly.
Sure do.
People can be appropriate, but for the most part.
What are some other tips we can do? So lifting a foot up. What are some other things? Breathing.
Breath work, absolutely just do it. Sounds too easy. Do the thing that sounds the easiest the most often, because that's the thing that's probably gonna help you the most. Breathing will help you the most. If that's the only thing anyone ever learns from me, is that they do their diaphragmatic breathing correctly every day, they're gonna improve. There's 1,000 other factors, right? You're not gonna be cured by breathing. Please don't think that, but it's definitely one thing.
Yeah, it's to breathe. A lot of people don't actually learn how to breathe well.
Right, yeah, yep. When I teach it like a balloon. So the skinny part of the balloon is your esophagus, and then the balloon gets bigger, and then your diaphragm is actually the top part of the balloon. So as you blow it up, it drops down into your belly, it fills your rib cage, which is how we get that 360-degree breath, because the widest part of the balloon is at the bottom. And when you breathe like that, everything opens smaller. It's not, right? So many people breathe their neck, or they only breathe in their belly. They're like, oh, I'm belly breathing. Okay, do you have lungs in your belly? No, right? Your belly's gonna move because your organs are moving, but it's not necessarily blowing up. People, pretty dramatic sometimes when people breathe that way.
I like the balloon visual, because
Yeah.
it is.
Yeah.
You're breathing through your back as well.
Yeah.
It's the whole
And if you
thing.
put your hands around your rib cage, you can feel it all the way around. You should feel it in your thumbs, you should feel it in the palms of your hand and in your fingers.
So what are some things people could be doing unintentionally to make their pelvic floor worse? Like the belly breathing.
Breath holding when they're baby, getting out of bed during pregnancy when you roll over and you're like, don't do that.
Yeah.
Right? Blow out, right? You're starting an abdominal engagement. You're giving yourself more support. All of those things will help lessen back pain, pubic symphysis, all of those things, because you're more engaged when you're moving.
We talked about pushing while going to the bathroom, pee, especially pee, and then not blowing your nose. Blowing your
On the
nose while
toilet?
you're on the toilet.
That one's a hard one for me because I totally do it. You shouldn't do it. You're in a vulnerable position.
Yeah. It makes me think of trampoline.
Right. Trampolines are a little bit different because you should have that recoil and that bounce back of your pelvic floor. But when you're on the toilet, you're supposed to be relaxed, and then you're adding undue pressure. So if you're not really paying attention, don't do it. Don't be like me.
Yes. Do as you say, not as. Then finding a therapist. How would maybe someone lives in Colorado and they, see this video and they think, I need pelvic floor therapy. How do you find a therapist that is good?
Yeah. Always, if you therapists, first and foremost, if they're good, they're gonna suit you and your personality. There. Feel with your intuition. If it feels good, start there. But there are what is the word? Again, up all night.
Certifications?
No,
Education?
there are directories,
Okay.
for sure. And I can get the website for you, maybe we can put it
Yeah.
on. I know that one for sure. And then there's some that, like, if you go to people's certifications, like sometimes they will be listed.
Yeah.
Certification is not everything.
Something.
It's something,
Mm-hmm.
but it's not everything. Every pelvic floor therapist is gonna be so different, right? I'm a very manual therapist. I dove headfirst into pregnancy and postpartum. That is my jam. Like, I love it. I'm a doula, like all of the things. I love working with women. That is where my attention went. There are gonna be people who only do peds. So they only work with kids. There's people who are working with men and women. There's people who only do neurologic conditions, people with spinal cord injuries, and they're doing like neurologic bladder and bowel. You really have to just find what is gonna work for you. And if you have a question, call, like, hey, here's what's happening, do this. And they either do or they don't. And most people, if they don't, or they don't have resources for you, they should be able to refer you somewhere else.
Well, and I think if you were to reach people in the birth community, I think a lot of people in the birth community tend to keep really good referral lists, especially for pelvic floor. I know I personally have a referral list for chiropractic, pelvic floor, mental health, all the things a client could potentially face in pregnancy or postpartum. I try to keep a list of referrals.
Yep.
So people might reach out to, birth communities. in
Yep.
their-
Mm-hmm.
Yeah.
A friend.
Yeah.
Hopefully you have a who has done some kind of
Or
pelvic
OT.
floor. Yeah.
Yep.
Yeah.
Yep. And then anything, right? If you're going to a provider and they seem to know everything, but they don't really feel like they know everything and they're not willing to admit that, find yourself someone else. As a therapist, I'm not afraid to tell you I don't know.
Right.
I've never seen that before. I'm willing to find out, I'm willing to learn, I'm willing to send you somewhere else if needed. Like, that's always, you are driving this bus. I'm just here to help.
Jobeth, for those that are concerned about the examination, can floor therapy be done without?
Absolutely, 100%. Yep, it's a good piece of information, but there's other ways to find that information. There's other ways to do releases. There's lots of people who would be able to say, all right, let's try something else. Yeah. And even if you quit and you're like, no, change my mind,
Yeah.
your therapist should be like, okay, no problem. Switch gears. That's what we do. We're here to care and help people, pour into people. When people leave me, I hope that they just feel like I poured love into them and go from there.
Your model is a little bit unique because you go to people's houses too.
I do.
That's super cool.
Yes, yeah. So I but I'm dual licensed in Washington and Idaho. So I travel about, loosely, about an hour away from my house in all directions. I try to book people on the same day that are in the same area so that I'm not like all over because I'd be birthdays. But so like I'll have like a day where I'm all north side of Spokane, and then I'll have a day where I'm like, I have Priest River, and I have like Pinehurst is the farthest one right now in that direction. I have somebody like out past like Sprague, Washington. So it's pretty wide, but I will have access to care. That's the number one reason why I did what I did, and the reason that I travel. So.
Well, and it's hard too. I know you and I have had this conversation in the past. When you go into like a practice and a bunch of other therapists, like you can't bring your kids.
Or you can, but it's hard.
Yes. I know I personally couldn't because my son
Right.
would be gone. He would be gone unless the door was barricaded.
Right.
So that's such a unique thing that especially for moms of littles, that you can come to their house and, okay, if kid is climbing over mom's head, we're doing
Yeah.
pelvic therapy, okay.
Yep, it happens. Most is like under the table,
Yeah.
we're playing while working, like, I love that part of, like, when little kids learn my name, like, oh, it's the greatest day ever. So, yeah, that's part of the job, because the mom is not just the mom, she is the family, she's the basis,
For sure.
and dads are wonderful too. They are,
Also important.
yes, they are wonderful too.
Awesome.
Yeah.
Any other questions? Any questions that you guys have?
But when, like you're having intercourse, not being able to feel a lot,
Mhm.
it's, like that's a sign of like a pelvic floor.
Tight. Mm-hmm. So,
It's like a baby and not.
no, not necessarily. No, generally muscle is tight. We have less blood flow to that area. So we have decreased sensitization of area because it's not moving, right? We don't have friction like we would have. Things aren't gliding and sliding like they should. So that that sensation can be decreased or diminished. And after you have a baby, sometimes we need vaginal estrogen to help lubricate the tissues and help with healing. And as we get older and we go into perimenopause, we were talking about this earlier, vaginal estrogen can be really, really, really beneficial. So, yeah.
Because I've been PCOS, and so I tend to have a lot of estrogen.
Vaginal is different.
It's different.
Yep. Yeah, it absorbs differently. So it's just vaginal tissue. It's not systemic.
Oh, okay.
Yep. But with your situation, pelvic therapy would probably be the way to go first to say, like, okay, let's figure out like where you is, where you had excision before, have you had any abdominal surgeries, like all of those things are gonna, does that make sense?
Yeah.
And then those symptoms came like,
Yeah.
and so there's things we can do to kind of bring that down and get you want to be without adding. If I suggest something like a estrogen to somebody, it's because we've tried everything else first.
Yeah.
Like I try to give you the possible things that I can think of, that I've tried, that you're like, yeah, right. But they work, right? We try that first.
Any other questions? No? My last closing question would be if there was one thing that you wanted people to take away from today, what's kind of the most important thing you'd say?
Even question whether you need pelvic floor. Do it. Do it. Give yourself that, like a luxury. It's not a luxury to yourself, but give yourself permission to put yourself for once.
And if that's not the problem, then at least you know you cross it
Yeah.
off the list. And I should have done
Yeah.
pelvic floor therapy 5, 10, 30 years ago.
Right. Yep. And a good therapist is be able to say, you know what? I'm not finding anything. Let me put you in touch with somebody else. Here, let me prescribe you 8 times, twice a week, this and this and this. No. Before their hands on you. Don't do that. Please don't do that. Like they need to assess you before they ever give a recommendation, in my opinion.
Well, thanks so much for being here.
Yes.
Yeah.
And
Y'all
the
learned so
easiest way to
much.
get a hold of me is to text me or to call me. I'm on Instagram and Facebook. I don't have a website but yeah, so, and I'm pretty available to back if I'm with a client. Obviously, I'm not going to, and I'll get back to you either that evening or in the morning.
Do you take insurance?
I don't, but I can provide super bills for people, and we've had really good luck. There's only a couple that I won't do it for, and it's only because it's a headache for you and for me. Yeah. But yeah, for the most part, really good
Yeah.
return.
And then what do you charge for?
So right now, depending on where you live, okay? So if you live a certain way, I charge a very small travel, but again, it's gonna depend on, it's gonna be anywhere from $15 to $30 for that. But that's if you're like the boomies, okay? If you're not, if your eval is $275, it's an hour and a half with me. We get to know each other first, and then we do a full assessment and a full treatment in that first day. So you're not coming in for 45 minutes saying, okay, here's what's wrong. I'll see you next time. Let's try to work on it then. That wasn't the model that I wanted. And because I am the boss and I am the only employee, I get to do whatever I want. So that time is important. And then that follow-up is an hour, and those are $190. So thank you for having me.
Thanks so much.
Yes, I'm
Yeah.
glad my no sleep brain worked.
Pretty crazy windstorm. It just, but you had the worst of it, I think. So thank you so much
Yes.
for being here.
Yeah, I appreciate it and for reaching out and for thinking of me.
Always.
I appreciate it. Thanks, ladies.